Hi everyone, welcome to the Body Manual. My name is Annabelle and I'll be your physical therapist today. I will be talking about the TMJ or the temporomandibular joint, also known as your jaw. So every time somebody says, I have TMJ, usually they mean to say TMJ disorder. So what it is basically where your bottom jaw or this bone here meets part of the rest of your skull basically. And if you feel right in front of your ear, you can Google how it looks like, and if you've seen a skull before, you'll notice that what you feel is also what you see. So basically what you want to do is feel for both sides, and you want to put your fingertips right on top of it, on top of that bone. And when you open your mouth, you'll notice the bone moving. That's basically your chin, your jaw, or your bottom jaw. So some people might notice that one side doesn't move at the same time as the other side. One side has delay. There might be pain, clicking, and things like that. So what you want to do here, so your bones are connected by ligaments. There are also muscles that cross those bones. So that's what helps move the bone down. So we do have muscles that attach to this part of our chin. And so that also helps with us whenever we talk. And here there are muscles that pull the jaw down, and that helps us open our mouths. And again, there are ligaments here that connect those bones together. So when people have clicking, when there's a delay with mouth opening, when there's clicking when you bite into an apple or what things like that, what I usually tell my patients is to take care of this area. Okay, so also the later in life you are that you don't take care of that, you'll notice there are people who talk like this just with their mouths and they don't even move their jaws. It's not that it's too late, but there's already a lot of things going on there. So that's some kind of severe TMJ disorder. So you don't want to get to that point. So that's why I wanted to make this video. But be careful, again, as with all my disclaimers, if any of these massages or soft tissue mobilization exercises cause any pain, or if you already have pain previously, do consult with your doctor and your physical therapist, and they will help you with your symptoms. So basically, you're going to outline what the jaw looks like, okay? So this is the mandible, what this part of the mandible looks like. So you're just gonna follow it around. So anytime there's a joint, whatever muscles or ligaments that cross the joint, you want to make sure it's mobile so that you can move your joints and your muscles and your bones with less effort and with less pain. So when things like this happen, when it gets tight here, it's probably because people grind their teeth, or they grind or they bite down, or when you're stressed you clench your jaws. So these muscles need some love too. So you want to make sure that you're massaging or mobilizing those muscles. It feels really good, but just follow your muscles up and down. These muscles are what helps with chewing. The Buccinators or Buccinators. So if it really does feel good. So make sure you take care of those muscles and those ligaments and those joints. So basically what you want to do, so if you don't feel the jaw opening at the same time on both sides, practice in front of the mirror. make sure that your chin is going down center, in the same line as the rest of your face. But you can do this by using your teeth, the middle part of your bottom teeth and the middle part of your upper teeth, that they stay aligned, and just make sure that you follow a straight path coming down. So use a mirror to do this, and you're gonna do this and make sure that they do open at the same time. Because if you feel that your jaw is protruding in this direction, it's telling me that there's more tightness here, so that's why it's pulling me towards that way. So I would massage this area right here even more, and whichever side it goes to usually is where it's tighter, so that's where you'll have more pain. So do the same on the other side. And what I do is I basically take my fingers and I kind of push in this direction, very gently though. You don't want to push your actual bone towards that way. I'm just working on a soft tissue. Kind of hard to do this when you're talking, so you want to do that. And you can even, if there's no pain doing that, you can kind of mobilize with movement and say ah as your fingers come down, or even stay in one place and just say ah. Okay, and you also want to get your thumbs under this area here. To loosen the tendons along this area. And then the other connection would be above your collarbone. Just like that. Okay, so that's just a quick way to keep your jaws healthy. There are other things you can do if it is weak, and if one side is stronger than the other. You know, there are other ways to do this, but you do want to get an evaluation done by your physical therapist. So go ahead and give them a call, and they can help you with that. There are also therapists who do specialize in just the temporomandibular joints. Not just, but they specialize in those joints. So that might be something to think about if you've been having this problem for a long time. But if you don't have any problems, or if you're starting to feel like, you know, you get headaches and things like that, this is one of the things that you can do. You can even also just gently massage these areas here. It's especially good for when you grind your teeth or when you clench your jaw. So this bone right here, remember that you can find it by moving your chin down or opening your mouth, and then right above it, you're just gonna kind of gently push up, just like that. And these muscles kind of fan out like this, so you can go in this direction and going up. Okay. If you have any questions, leave me a comment or email me. And I hope this little video helps. Thank you. Bye.